Hi there, my name's Kunal Patel, one of the dentists here at Southview Dental Care. I hope you're all keeping well at home and keeping safe as well. As you may be aware that the practice has been closed just following the guidance set by the NHS. However, we're hoping we can give you some advice just to if you do have any troubles at home regarding toothaches or pain or anything like that, how that can be managed. The main reason you can get toothache is down to decay, broken teeth, lost fillings or broken fillings, loose teeth, and also just sometimes randomly sporadic pain caused by a deep filling or a potential crack in a tooth. This advice basically helps to try to manage that. Before I go into the two main types of painkillers we talk about, which are paracetamol and ibuprofen, it is all case dependent, and depending on your medical history, whether you can take these medications due to, if you have any allergies or if you have any contraindications with any other medications. If you think you can't, or you don't know if you can't, just give us a call up and see if we can help you over the phone. The first protocol we talked about is paracetamol, which is 1 gram every 4 to 6 hours, so about 4 times daily. Normally they come in 500 milligram tablets, so 2 500 milligram tablets every 4 to 6 hours. Or you could take ibuprofen 400 milligrams, again 4 times daily, and every 4 to 6 hours. Ideally you want to try and interchange them. Let's say potentially taking paracetamol first, and then once that dose is finished, switch over to ibuprofen, then back to paracetamol, and then back to ibuprofen again. Take this for up to 72 hours, see if that helps manage the pain. If it doesn't, give us a call, and the symptoms get any worse, if there's any sorts of infections or swelling, you may need some antibiotics if needed, but just give us a call and we can see if we can help you. The next protocol I want to talk about is sensitivity. That can be either down to, again, a tooth chipping, recession around your gum, which means more of the tooth's exposed. If that does occur, the first thing you want to try and do is get hold of some sensitivity toothpaste. There's a few different brands out there. Pop a little bit on your finger and literally just rub it on the tooth and leave it. Don't gargle or rinse out afterwards, just let that soak in and see if that helps with the sensitivity. Normally the symptoms you get with that are like a sharp pain for a couple of seconds once the stimulus hits the tooth, and then that goes away. The last thing I want to talk to you about is about wisdom tooth pain. Now often it happens when you have your tooth that's partially erupted and there's a flap of gum overlapping it. If any debris gets stuck underneath there, it can cause inflammation of the gum around there. Try and keep it as clean as possible. That's the best way to try and alleviate the pain, is good oral hygiene. Even if it does hurt, make sure you are cleaning around that area as much as you can. Warm salt water mouthwashes are great as well, just to try and flush any debris out. If you can, and you haven't got any allergy to Corsadil, so that's chlorhexidine mouthwash, that's great, just to, again, as an antimicrobial mouthwash, just to help keep that area clean. And kind of follow the painkiller protocol that I just mentioned earlier. Similar thing again, if the pain doesn't subside or you start getting a swelling, then give us a call, and we may need to prescribe something else, antibiotics if needed. But try these kind of local measures first, see if that helps. I hope that helps. Keep safe, keep well, and we'll see you soon.